Welcome to the Deep Dive. Today we're jumping straight into something really important for heart health.
That's right. We're looking at cholesterol blood tests, specifically using a great guide from Blood Test UK for folks in Liverpool.
Exactly, our mission. Break down this health info, make it super simple, and really focus on the good things, the benefits that come from getting this test done.
It's all about making it easy to understand.
Okay, so let's unpack this guide from Blood Test UK and see how easy it really is to look after your health, especially if you're living in Liverpool.
Right. So first things first, getting an accurate test. The guide is really clear on this.
How do you do that?
Well, the main rule is fasting. For most people, that means no food or drink for about 9 to 12 hours beforehand. Just water is okay.
9 to 12 hours. Why so long?
It's actually pretty simple. We want the test to see the fat, the cholesterol that's already in your body normally.
Not the fat from, like, the toast you just had for breakfast?
Exactly. So the test isn't skewed by your last meal. And drinking water helps too, makes the blood draw easier. Staying hydrated is good.
Okay, that makes sense. Now, here's where it gets really interesting for me, understanding what the results actually mean. There are a couple of main players in your blood, right? Acting kind of like opposites.
That's a good way to put it. You've got HDL cholesterol, that's usually called the good cholesterol.
The good guy. Why is it good?
Because it helps remove the other kinds of cholesterol from your blood, sort of like a little cleanup crew, takes it back to the liver to be processed.
Okay, cleanup crew, I like that. So what's the other one, the bad guy?
That would be LDL cholesterol. It's called bad because if you have too much of it, it can start to build up on the walls of your arteries, like plaque.
Plaque. That sounds bad.
It is. Over time, that buildup can narrow your arteries, which increases your risk for heart problems, even stroke. The test also looks at triglycerides.
Triglycerides.
No.
What are they? More fat.
Yeah, basically. They're another type of fat in your blood that your body uses for energy. But again, if the levels are too high, it's not good for your heart health. Also adds to that artery clogging risk.
Got it. So good HDL, bad LDL, and watch the triglycerides. This brings us to the biggest benefit, doesn't it? Early detection.
Absolutely. That's the core message here. The recommendation is usually to get tested every 4 to 6 years, for most adults anyway.
And why that often?
Because high cholesterol often has no symptoms. You wouldn't know you have it unless you test. Finding it early means you can make changes before it becomes a big problem.
Simple changes, right? Like diet or getting more active.
Exactly. Small adjustments now can help you avoid serious things like heart disease or a stroke down the line. It's preventative.
And this is where that local Liverpool info from Blood Test UK really hits home. They mentioned some local research.
Yes, they did. It's fascinating. The guide points out that studies in Liverpool have shown something really positive.
Oh, yeah? What's that?
Well, in communities where more people are getting screened for cholesterol regularly.
They actually see fewer hospital visits related to heart problems.
Wow, really? So getting tested doesn't just help you, it actually helps the whole community health picture in Liverpool.
Precisely. It shows these tests have a real, measurable impact on public health. It's not just an individual thing.
That's powerful. And Blood Test UK also makes it clear how easy it is to get tested in Liverpool. Convenience is key, isn't it?
Definitely. If it's hard to do, people won't do it. The guide lists loads of places.
Like where?
You got the big hospitals, obviously Royal, Liverpool University Hospital, Aintree University Hospital, but also specialist places like the Blood Test Clinic.
And even pharmacies. I saw Boots and Superdrug mentioned.
Yep. Makes it super easy to fit into a busy day. Pop in on your lunch break, maybe. That accessibility is crucial.
And people seem to find it okay. The guide mentioned patient feedback.
Yeah. The testimonials suggested people found the staff supportive, the actual blood draw was quick, and the whole thing wasn't as scary as maybe they thought it would be. Less intimidating. That's good to hear. Removes another barrier. So tying it all together, this testing is like a motivator.
It really is. When you know your actual numbers, the HDL, the LDL, the triglycerides, even if they're not perfect, it gives you concrete information. It pushes you, empowers you really to make those healthier choices, which in the end improves your quality of life, maybe even how long you live.
So what this all boils down to for you listening right now is that taking control of your heart health can start with just one simple test.
It arms you with knowledge. Knowledge is power, right?
Absolutely. So here's a final thought for you. Building right on that idea of taking action, inspired by this Blood Test UK guide.
What's one small thing you could do?
Exactly. What one simple heart-healthy change could you start this week? maybe adding an extra piece of fruit each day, or starting a regular walk, just 30 minutes.
Something achievable.
Right now.
Yeah.
Even before you think about booking that next checkup. Take this idea, this data point, and, well, run with it. Remember, all this great info came straight from the guide on Blood Test UK.